Michiganders vaccinated. The opening of the Ford Field Mass Vaccination Clinic on March 24th began what has become, over the last 8 weeks, a quantifiably successful effort to get shots in the arms of Michiganders, and specifically residents in the Southeast Michigan region. The Detroit Ford Field site was intended to reach historically underserved populations, not just in the city of Detroit, but all of that Southeast Michigan. For our goal was to conduct outreach to communities who might not otherwise be able to access vaccination resources and support our partners' efforts to expand outreach beyond the Ford Field location with mobile clinics. We had a special focus on equity in vaccine administration by reaching socially vulnerable, underrepresented populations. I'm delighted to report that the Ford Field Clinic ends today. We have met those expectations. The Ford Field operation represents a team effort. When we launched Ford Field, you heard many of us talk about the partnership that was coming together to make this vaccine clinic possible. This team has routinely exceeded our daily target numbers at Ford Field, and combined with the mobile operations have provided over 275,000 doses of vaccines to Michiganders. The Ford Field team has delivered shots in arms, currently 4,000, 12 to 17-year-olds, either on-site or mobile. Over the 8-week span, only 331 doses were wasted or spoiled. That amounts to less than 0.001%, which means the team at Ford Field successfully utilized 99.99% of the vaccine we received. As of Thursday last week, either through the on-site operation at Ford Field or through its mobile vaccine clinics, nearly 270,000 Pfizer doses and more than 1,000 Johnson & Johnson doses were administered. Wayne, Oakland, Macomb, and Washtenaw counties in the city of Detroit account for 257,346 of those doses administered through Ford Field as of 30. That's 95%. We are absolutely thrilled by the progress we made in such an important time as we work to protect our communities around the state. I can't even imagine if we could have reached these numbers without the Ford Field Clinic and the partnership that has gotten us to this point. So with that, I want to thank some of the folks who'll be hearing speak today. Detroit Lions team president and CEO, Rod Wood. Acting Director, Acting Regional Administrator for FEMA Region 5, Kevin Sly, and Dr. Stephen Rockoff, Service Chief of Emergency Medicine at Henry Ford West Bloomfield Hospital, who served as Medical Director for the Ford Field Mass Vaccination Site. Now, they weren't with us today to speak to you during this press conference, but I also want to give a special shout out to Meyer, who was a really critical partner in all of our efforts here at Ford Field. So with that, let's get on with the program and let's hear from Lions CEO, Rod Wood.
Thanks, Carrie. We kicked this vaccination site off 8 weeks ago. We had a press conference at the time that included Governor Whitmer and Lieutenant Governor Gilchrist. I said at that opening press conference that Ford Field is regarded as a great venue for sports, music, and having a lot of fun. I also said at the time that this might be the most important event we'd ever hosted. The last 8 weeks, we've transformed Ford Field into the largest on-site inoculation clinic in Michigan during the worst health crisis and pandemic of our lifetime. On behalf of the entire Lions organization, we are so proud that Ford Field was selected as that site, and we developed it into one of the nation's first community vaccination sites to service the entire Southeast Michigan region. The vaccination clinic we hosted is a great demonstration of the partnership between federal, state, and local government. Also important is the partnership with the private sector. Henry Ford Hospital and Meyer are both great partners of the Lions, and we're awesome partners during this clinic. We are privileged to have worked alongside them and been part of it. Game day last year at Ford Field was not the same without our fans. And we know how important sports are to the city. We're a great sports town, and we're eager to get everybody back in person watching their favorite teams and doing so safely. We're very much looking forward to having Ford Field full this fall with our fans cheering for the Lions and doing it safely. And hopefully this vaccination is a big part of what gets us there. Last week, our rookies arrived, so football is starting, and we're actively planning for the return to training camp next week and for Ford Field on game day. Can't tell you how excited we are to look forward to having our fans back in the stadium, not only for football, but for concerts and all the other things that Ford Field is known for. So thanks again to all of our partners for this historic initiative. We're so happy to have been part of it and serving the community. And now I'd like to turn it over to Kevin Sly, the Acting Regional Administrator for FEMA Region 5. Kevin.
Thank you, Rod and Carrie. Good morning. Since the outset of the vaccination effort, FEMA's mission has been to help our state, tribal, and local partners as they work to deliver this life-saving vaccine to all Americans. To expand these efforts, the Biden-Harris administration directed FEMA to establish pilot community vaccination centers in key locations across the country, like the one at Ford Field. These sites were scheduled to last 8 weeks with personnel support provided by the Department of Defense. The Ford Field location would not have been possible without a close partnership between all levels of government, as well as the private sector and voluntary organization partners. And as we wind down operations at Ford Field, we're staying closely connected with our state and local partners to identify areas where we can continue to support their ongoing vaccination efforts. This will include providing 100% federal reimbursement for eligible vaccination costs, commodities, including PPE, and direct support of personnel to support outreach and community engagements. And we want everyone to know that the vaccines are still available. So please do your part to get yourself, your loved ones, and your community vaccinated. I want to thank Governor Whitmer and her team and all of our partners for this amazing effort to not only meet vaccine equity, but also to drive it through the mobile vaccination clinics in and around Detroit. Now it's my distinct honor to introduce Dr. Stephen Rockoff, Service Chief of Emergency Medicine at Henry Ford West Bloomfield Hospital. Dr. Rockoff served as Medical Director of the Ford Field Mass Vaccination Site, and his leadership was instrumental to the successful results we have achieved here. Dr. Rockoff?
Dr. Rockoff, we need your mic turned on, please, if you wouldn't mind unmuting.
Yep. Thank you, Kevin. When we were selected as the health system partner for the Ford Field Mass Vaccination Site, our mission was to accelerate Michigan's efforts in getting vaccination in people's arms. When the Ford Field site opened on March 24th, more than 3 million doses of vaccine have been administered statewide. Today, more than 4 million doses of vaccine have been administered across the state, and Ford Field has helped drive that increase in shots in arms. I'm really proud of what we have accomplished in 8 weeks here. I especially want to express my gratitude and appreciation to our partners who made our success possible, specifically the state of Michigan, the Michigan State Police Emergency Operations Center, the Michigan Department of Health and Human Services, the Department of National Resources, our federal partners in FEMA, the U.S. Air Force and Department of Defense, U.S. Coast Guard, our local partners in Meyer, the Detroit Lions, the City of Detroit, Wayne, Oakland, Macomb counties. I also want to thank Henry Ford team for their exceptional expertise and oversight they brought to our team, which helped in our success in this mass vaccination site. Specifically from our experience as a health system in standing up our own mass vaccination site, as well as our extensive work in infectious disease, emergency management, disaster preparedness, and EMS operations. Specifically, I want to thank Dr. Sam Wasalam, Rox Gita, Valerie Gunn, Dr. Dennis Cunningham, Dr. Howard Klausner, Dr. Matt Ball, and all the emergency physicians who helped and assisted, who worked on the floors of the clinics each and every day. The collaboration of our partners was truly amazing. We came together to do one mission, and it felt like we had worked together many times before. Our goal was to maximize our efforts to reach as many people as possible. COVID cases were surging in Michigan at the time, and it was a race to save as many lives as possible. As the medical director for the site, our role was to provide medical guidance of operations here and ensure the vaccination process was carried out safely. On both fronts, we were incredibly successful. From the time we opened the doors at 8 in the morning till we closed the doors many nights at 8:30, 7 days a week, our process was extraordinarily efficient, seamless, and safe. Many times from the time that our clients checked in until the time they received their vaccination was under 10 minutes. To date, more than 245,000 doses of vaccine have been administered on site. On one of our peak days, we've actually administered just under 7,000 doses, and many days we've done north of 5,000 to 6,000 doses a day. Out of the 32 of these federal vaccination sites, we are one of the top performers of shots in arms administered nationwide. Here, specifically at our site, we were able to accommodate over 24 languages. We were able to assist those with disabilities, and even some nights during Ramadan, we even stayed open longer to assist those who were fasting. In closing, I want to thank the Henry Ford Health System for their support in this effort. Our health system has stepped up time and time again for the citizens of our state of Michigan during the pandemic. We've done that by taking care of patients at all of our hospitals. We did it again last year during the first surge with opening of the TCF Field Hospital, and now assisting with this mass vaccination site here at Ford Field. I'm immensely proud to be part of our organization, and especially what we accomplished here at our mass vaccination site. With that, I'll turn it over to Carrie.
Thank you, Dr. Rockoff. And, just exactly what you want to see happen when you're in crisis. We want to see all levels of government coming together with private partners, nonprofits to help support our communities and safeguard our public health. So to use what may consider a cheesy saying, teamwork makes the dream work. With that said, as we are celebrating the progress we've made here at Ford Field, we have more work to be done. We recognize the challenge that lies ahead for our state as we continue to try to get all eligible Michiganders vaccinated. Vaccines are now widely available across our state, but demand is slowing. Some people are reluctant to get the shots. Others have not been able to because of their work schedules, childcare, lack of transportation, or other obstacles. Nationally, public health authorities are responding to these challenges by shifting efforts away from large-scale vaccination sites and focusing on communities that have the lowest vaccination rates. This hyper-local approach, using census-style canvassing operations, education campaigns, mobile vaccination events, hinges on making the shots easy to reach and helping the hesitant change their minds with the right educational materials. Toward that objective, the MDHHS recently commissioned a statewide public opinion survey. The first goal of the analysis was to collect data on what will allow MDHHS as well as the Protect Michigan Commission to empower people with the information they need to gain confidence to get vaccinated. The second goal was to collect data that will support the plans and decisions related to reopening. The analysis is based on an online survey of the representative sample of Michigan's population, balanced by demographics and region of the state. The survey was conducted between May 5th and May 9th. Here are some quick takeaways, and I'm going to be as brief as I can. Although more than 70% of Michigan's residents report they are vaccinated or have a plan to get vaccinated, there is, however, some strong resistance among those not yet vaccinated. Residents in the Thumb, Flint Bay, Saginaw region show the highest resistance. And in Wayne, Washtenaw, Monroe counties has the largest share of undecided residents. Of the unvaccinated group, 2 in 3, or 64%, expressed rejection of the vaccine. And 1 in 3 expressed openness to get the vaccine under various circumstances and motivations. The survey asked residents how much they trust different people and authorities that provide reliable information. The authorities or people that Michigan residents trust the most include personal doctors, family members, and the CDC or other public health agencies. The survey asked residents if they had a preference for what type of vaccine. And let me tell you, Pfizer has large support. As you know, they have a base of operations here in Michigan, and it is shown by the community support here. So Pfizer is the #1 preference if you were to choose your vaccine. Of the 82% of respondents that reported to have preferences, like I just said, 55% said they prefer Pfizer. That's twice the share of respondents that reported they prefer Moderna, and almost triple that of Johnson & Johnson, which was at 19%. The survey also asked residents about the governor's 4-step back to normal plan to ease Michigan's COVID-19 restrictions. Overall, 61% of Michiganders support back to normal plan. While there's certainly some adjustments that are being made relevant to the CDC's announcement last week, lifting mask restrictions for people who are vaccinated. We will continue to encourage people who are not yet vaccinated to please do so in order for us to safely return to normal and restoring capacity limits. Finally, the data show a link definitely exists between reopening and vaccination rates. About half of the respondents say the plan to tie reopening schedules to vaccination rates encourages them to get vaccinated. So we're going to use this data to help inform our decisions moving forward as we transition from large-scale clinics and look to develop new partnerships that have a hyper-local focus, including grassroots activities. Much of this we also learned during our pilot program that DHHS conducted earlier this year. So with that, we're still marching on our mission to get 70% of the state vaccinated. And I hope all that are listening, you join us. If you're a doctor out there, please encourage your patients, do a short video, make sure it's known. Please encourage all your friends and family to get vaccinated. Again, this is our best tool to safeguard our loved ones from the worst impacts of this disease. So with that, that's going to end our press conference. I know a few of us can stick around to handle a few questions. Just want to do a quick reminder that we will be sending out a press release after this event that will show additional Ford Field highlights and info from the public opinion survey research. So with that, please make sure to enter the chat room and let us know if you want to ask a question. We will recognize you in the order we receive questions and turn on your microphone at that time. Thank you, and let's do some Q&A.
So Carrie, first question is from Christina Hall at the Detroit Free Press. Christina?
Yep. Can you guys hear me?
We can. Thank you.
Great. Can you talk a little bit about the 1,000 J&J shots? I know you guys were hoping to do 5,000 shots a day, and 1,000 J&J since May 4th is very low, I guess, to put it as an understatement. Can you talk a little bit about why that is? And also, can you talk about what happens with all of the extra doses of vaccine after today? What happens with all of that? Thank you.
Sure. Well, I'm happy to kick us off on that. I would say that, while that is what we administered as it relates to Johnson & Johnson vaccine, we were able to do some additional first dose Pfizer vaccines. And as we mentioned in the public opinion research, there is a preference here in the state of Michigan for Pfizer. And I think we need to be realistic in terms of the pause on the Johnson & Johnson vaccine by the CDC to take a deeper look at some of the cases that sprung up with a severe clotting issue. So I think that that gave some people pause. I do also think we need to recognize in terms of where we are in our broader vaccination rates in Southeast Michigan, that, there was essentially a supply challenge earlier this year. Ford Field helped us get beyond that with these additional doses on top of the state allocation. And by the time that both that J&J pause and where we were in terms of our vaccination rate, I think things naturally slowed at Ford Field. But let me just pause there to see if Dr. Rockoff or if there's other panelists that would like to add on to that response.
Carrie, I think you summed it up pretty accurately in that, due to the pause, it may have given some reservation to some of our clients, and the fact that we've had so much additional Pfizer available, as you mentioned, people in the state of Michigan are more familiar with Pfizer, so they chose Pfizer. And on site here, we did offer both vaccines. So we were, again, as you mentioned, successful in vaccinating more people here.
And can you just answer what happens with the extra vaccines after today's clinic closes at 8:30? Thanks.
It more than likely will be redistributed to other sites. That is, FEMA would more likely be able to address that.
Hey, thank you, Dr. Rockoff. So there's a process that each of the states have to go to, the request to reallocate the unused or the shelf doses, and it's a fairly quick process, very, very quick turnaround. So as the state requests to reallocate, it's probably less than a half a day request process, and we push it up to FEMA headquarters and we allow those doses to be reallocated throughout the state to be utilized at state-run community vaccination centers or smaller mobile vaccine clinics or out in the rural areas. Thank you. Great question.
Eric Lloyd, our friend from TV 9 and 10 News in Cadillac. You're next up, sir.
Hello, thank you. I was just wondering, when it came to the survey and the hesitancy, these outreach movements you guys have been doing, what has been the response to that? Are you finding that people are responding well and actually changing their mind when it comes to getting the vaccine?
Yeah, I'll kick that one off as well, Eric. Thank you for that question. And I think, what we're finding is there is definitely, we have to promote access. What does that mean? So additional pop-up clinics, mobile clinics, but we also have to promote access to information. So by doing that, as you know, life is busy. People have a lot going on, and we've been through a lot over the last year plus. And so we're doing a few things differently. One, we're increasing our canvassing across communities. You're going to hear more about an announcement in Flint later this week in terms of some additional door-to-door work in promoting community pop-up clinics. As well, we're going to be expanding that across the state with a similar formula. I think part of that is, these days, not everyone watches the local news like they did maybe 5 or 10 years ago. So promoting and bringing that information to the door is important. I think the other thing, as I mentioned, those that are trusted messengers, we need to lift those voices up and ensure they're communicating that outward. So that's why I call to action to any doctor that may be listening to this, that please communicate with your patients. Feel free to use Facebook and Twitter and all those digital mediums, because that helps promote where you are at on the vaccine and encouraging folks to get vaccinated. The same thing with family and friends and beyond. So that's what we plan on doing. We're also going to be working on additional partnerships with the Small Business Association of Michigan, as well as the restaurants, working across the state to increase a percentage of employees in those hospitality and retail sectors. Again, this is an all hands on deck moment once again, as we look to continue to squash and stomp out COVID-19 from our state.
Got time for 2 more questions. Kim Craig, you're up next.
Hi, folks. First to Mr. Rodwood with Alliance. How concerned are you about fully opening when the state's not at 70%? And do you anticipate or are you looking at whether fans will have to show a vaccination card? And then Carrie Ebersol, hi again. And just wanted to find out from you how many vaccines went unused at the not obviously not the spoiled ones, but went unused at the at Ford Field. And pardon me if I missed that number. That's it.
All right, I'll take the first one, Carrie. So, well, obviously, we're anxious to get Ford Field to 100% capacity, as I said in my comments. Hopefully, we'll get to 70% as quickly as possible, so we have some certainty around that, and we can start planning for the games this fall. In the meantime, we're continuing to work with every member of the governor's administration and the Department of Health and Human Services to work on tracking where we are and be prepared for games this fall. If for some reason we fall short, we'll step back and deal with those consequences at the time. As it relates to showing vaccination cards, we're not planning on that at this point, but if that becomes something that's required, we would revisit it. But I'm confident, given the trajectory we're on and where we are, that we're going to have Ford Field open this fall.
All right, for the second part, I love how Kim got a 2-parter in there for us. So I would say a couple of things. One is, and I'm just going to launch off a little bit about from where Rod responded there. And that's, again, what the vaccine does, our best tool to safeguard us against the worst impacts of this disease. And I know I don't need to remind folks of what those are: hospitalization, maybe even on a ventilator, or worse even, death. Okay, that is what we are competing with, if you will. So just really, it doesn't take much time. The side effects are very minimal. I can report my own that, a little bit of fatigue, a little bit of headache, and a world of comfort that has come after my vaccination. Now, to your specific question, Kim, to me, one is you mentioned about the wasted or unused doses. You heard the stat 331 in terms of where we were at as of yesterday for those doses, very small percentage. And there are no unused doses, which is great. And this is part of what Director Sly mentioned, that we're going to be reallocating doses, but we also are going to be continuing mobile clinics within the city of Detroit and Southeast Michigan and Wayne, Oakland, and Macomb counties through June 9th. It is. So for about the next 4 weeks, we are going to continue utilizing those doses through mobile sites as well. So just like a personal belief of mine, there's never extra money, just like there's not extra vaccine. We all need those shots in arms.
No, and I apologize. Maybe I misstated the question. Not, I know they're going to be reallocated, but like if 336,000 was the goal, and what was the goal? I know we're at 271 now. What was the goal? And so how many of those were unused if 336 was the initial goal?
Well, we are over 275,000, I think, as of yesterday. And Dr. Rockoff may even have more recent data since he's on site. But and then outside of that, again, any doses that were not allocated through the Ford Field location or the mobile sites would be reallocated through additional vaccine clinics.
And then our last question today will go to Mr. Tyler Scott with National Public Radio. Tyler, the floor is yours.
Thank you. Michigan Radio here. Kelly or Carrie, I'm wondering how much you can tell us about the plan you mentioned for Flint and rolling that out across the state. Since you brought it up, I'm wondering how much you can tell us today.
Sure, I'll describe kind of the efforts that we're embarking upon. One is we're going to be increasing partnerships with nonprofit partners around the state, as well as launching canvassing in neighborhoods. These will be largely focused on either low vaccine coverage areas and those high social vulnerability index areas by census tract. So that's where we want to, do that kind of hand-to-hand contact, if you will, knocking at the door, asking if folks have been vaccinated yet, if they have any questions, ensuring that they know where the most convenient location is so they can get their vaccine as quickly as possible. For those that want to make an appointment, some people just want to be able to walk in when they're doing their shopping at Target per se, but others want to, schedule it so they can plan for it. So we're just going to be increasing those efforts, and we're going to talk a little bit more about that later in Flint, but we're going to be looking at taking that across the state. Again, the march continues to get us to 70%, and we're excited to just increase the partnerships that are happening on the ground across the state and ensuring that we're providing the support those groups need to make it happen.
And Tyler, just as a shameless plug to supplement what Carrie said, we'll be doing a press conference on Wednesday at 10:30 in the morning with the Flint announcement. We'll be sending out a media advisory to everybody who's on this call today. We'll be sending that out tomorrow.
Perfect. Thank you both.
Absolutely. That's going to end our press conference for today. Everybody's got the media advisory, my name and cell phone numbers at the top, and email address. If you need anything today, don't hesitate to call or text or email me. Thanks very much, and talk soon.
Yeah.